In this video, we're going to take a closer look at the shoulder joint, or the glenohumeral joint, to give it its full name. So this is the right shoulder, so it would sit just there on me. And we have the humerus, which is the top of the arm. We have the clavicle here, which is a collarbone, which you can feel. We have the shoulder blade, or the scapula, which is the big flat bone that sits around the back. And then you also have this little bone here just coming off. It's called the acromion. That makes up the AC joint just here, which is the acromyoclavicular joint. It's one of the most mobile joints in the body, which means we have loads and loads of movement there. It's also one of the main reasons that a lot of people get problems, because there's a lot going on within this joint. So the glenohumeral joint is a ball and socket joint. The AC joint is a hinge joint because it only has one movement. Ball and socket joints are obviously the top of the head of the humerus sits in the socket just in here. The rotator cuff group, which a lot of you have probably heard of, is what we're going to mostly talk about, because that's a lot of the reasons we see going wrong with the shoulder. The main objective of the rotator group is to keep this head of the humerus into the socket, so keeping that shoulder in place and allowing it to move around. So as you can see from the tendons here, all they're doing is just keeping that nice and tight within the socket. So if you've ever dislocated your shoulder, it will be a stretching and an extension of the rotator cuff muscles and tendons, which often damages them as well. So people that dislocate their shoulder once often dislocate it again and again, just because all of this structure becomes a little bit weaker. A lot of that is due to falling, so sports like rugby, where there's a lot of impact going through the shoulder, or if you've ever experienced a fall and put your hands down to stop you, very, very common to damage that rotator cuff. We can also damage it through things like overuse, so shoulder impingement or swimmer's shoulder because of a lot of rotation. Racket sports also get a lot of problems here, especially overhead stuff, so badminton, tennis, where you're serving a lot or smashing a lot. Again, it's a lot of work within that rotator group. The muscles of the rotator cuff, so there are four, there's five if you include teres minor. So we have internal and external rotation. All of the muscles sit around the back of the body or posterior to the body. We have one muscle that does sit in front of the scapula and the rest sit behind it. The first one is the Superspinatus, and that sits just down in this little cavity here, and it comes through and attaches onto the back of the head of the humerus there. This allows us to externally rotate, and it also allows us to abduct our arm. So external rotation, that movement there, and then abduction of the arm is that movement there. So if you ever have had shoulder impingement, often it's this muscle that is swollen or that tendon that gets a little bit inflamed. So overhead movements like that become very, very painful, as well as external rotation doing that movement. Just below that sits the infraspinatus, which comes up and underneath here, and it attaches to the same place, and that is also an external rotator. That's the main external rotator, as it doesn't do abduction as much. Just below that, also behind the shoulder blade or the scapula, we have Teres Minor, and that sits a little bit lower and just attaches onto the lower surface there. And that mostly does adduction, so we're adding the body back, adding the arm back down to the body like that. So Superspinatus pulls up, Teres Minor pulls in. We also get a little bit from the deltoids when we abduct as well. When we come down to the front of the shoulder blade, so it's still posterior of the body, but it just sits underneath the shoulder blade here, is the subscapularis. And this comes through and underneath, and then it attaches to the front of that shoulder there. So a lot of people get pain at the front of the shoulder, and they think it's something to do with the anterior of the body. It's actually still on the back, it just sits underneath the scapula here. Because it attaches to the front of the humerus here, that allows us to do internal rotation, so that movement there. So again, we have external and internal rotation. All of that is done by the rotator cuff. We also have the abduction and adduction. So lots and lots of movement around here. Shoulder impingement, which is one of the most common things we treat for, is when there's either a small little tear within the muscle or the tendon, or they just become inflamed from overuse. The reason it is sore is because the tear will either be in one of these tendons here, or one of these tendons will become inflamed. We have a little space, which hopefully you can see just in here, which allows us to move the shoulder up, and it allows us to move it out. So if you imagine what the head of the humerus does within that socket, it moves around. If these tendons swell up a little bit and there's some swelling in the joint, once we start to move outwards, that space disappears, and that's when we get that sharp pain in the shoulder, and it can feel like it's pinching or just catching on a ridge in there. And that is what shoulder impingement, that is why shoulder impingement causes problems. The main way to overcome this is just to use the muscles in the way they're designed to be used. So we want to start to stretch and strengthen mostly around that rotational movement. So rotation that way and rotation that way. I will link a video to rehab for shoulder impingement at the end of this video, and hopefully that will help with your shoulder pain if you're having it. Hopefully that gives you a good idea of what's going on at the shoulder. It's a very, very complex joint. There's more than one joint around it as well, and it is commonly injured. Hopefully understanding it and knowing what the muscles are involved will help you look after your shoulders and keep them nice and healthy. Thank you for watching. I hope you enjoyed.